If I may, just before I read
Maybe I should explain it. Well, the motion is going to be to nominate both candidates. And then I'll call a roll call vote. And everybody has one vote. Get your name. Is our secretary here?
Yeah.
She'll record the vote. We set? Mr. Yule?
Yeah. Just to let you know that I'm going to abstain because I did not participate in the meeting prior to this, and I don't have enough information to
Okay.
probably vote. So, Mr. Chairman, I move to nominate Daniel Mills and Patrick Screamer as interim member of the Community Planning Commission to serve until May 2010 town election. This requires a majority vote of CPC and Selectmen.
Second.
Motion by Mr. Yule, seconded by Mr. Vino. We'll start with Warren.
Who?
Daniel Mills.
Mr. Scrimmer.
Daniel Mills.
Daniel Mills.
I wasn't keeping track of the count, so I'm relying on it.
I have 5 for Mills. 3. I abstained. Okay.
Yes. So on a motion of 5-3, the motion is for Daniel Mills to be appointed. So we will make an appointment slip, and will he be just notified?
Yeah, we'll notify him.
Okay. Thank you.
Okay, Mr. Scrimmer, thank you for coming.
Yeah, we'll be happy to sign
Happy
papers.
to sign your nomination papers. Thank you very much.
Okay, at which point, are you staying? No, the Pledge of Allegiance is next.
Pledge allegiance is first.
I was going to give you a chance to leave if you wanted before I rose for the Pledge of Allegiance.
Can we just take a very short break?
All right. pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Welcome everybody here this evening and our viewing and listening audience. First item on our, second item on our agenda, I should say, is the minutes of January 4, 2010 regular session. Mr. Yule.
Mr. Chairman, I move to approve the January 4th, 2009 regular session minutes as written.
Second.
Motion by Mr. Yule, seconded by Mr. Vino. Discussion, hearing none, all in favor?
Aye.
Opposed? Unanimous. We also have the executive session of 2010. Mr. Yule.
Yes, Mr. Chairman, I move to approve the January 4th, 2009 executive session minutes as written.
Second.
Motion by Yule, Mr. Yule, seconded by Mr. Vino. All in favor?
Aye.
Opposed? Unanimous. Anyone here for public comment?
No, Jeff?
7:30, we're not quite there yet to discuss town-owned land. About adopting the new ambulance,
Give me an opportunity to explain, Mr. Chairman. As you know, we have been involved in discussions, yourself, Selectmen, and the other members of the union, we've had a number of meetings, and one of the things that came up in the discussion that we had is our rates are currently tied to the federal Medicare rate reimbursement, and on January 1, the Medicare reimbursement rate decreased by 7.4%. The effect of that would be that the potential revenues that the town has to collect would go down. One of the proposals that was made to the committee and thought was meritorious in bringing before the board was to simplify the ambulance billing structure by adopting a rate in accordance with a number of our other communities, what they're doing, simplifying it and simply having a base, a BLS or basic life support rate, and then an ALS 1 and an ALS 2 rate. And then finally, a mileage rate, and that's per mile. And met with the fire chief, and as your policy states, you can entertain the change in the ambulance rates at any time upon proposal by the fire chief, and I recommend that you simplify the billing structure by adoption of these rates. What we will need to do is we will need to publicize the rates, and then after 30 days, they will become effective. That's what my proposal will be, and that's what my recommendation will be.
Mr. O'Leary.
Just for clarification, then, this is a substantial increase that's being proposed, first of all. How much do we collect above and beyond the Medicare rates? I mean, I don't see an awful lot coming before us at our current rates as far as forgiveness of debt.
Right.
You know, so insurance companies are covering one portion. This is for people who are on Medicare. Medicare carries the first portion, and then the insurance
Right.
covers the difference.
And then we chase down the balance
And we chase down the balance.
with varying degrees of success. And I'm not ready to bring to the board the copy of the proposed ambulance billing policy because I really thought it was too much to give you this evening. I just received it today. But if you go through there, you'll note that it does address the issue of balance billing. It does distinguish that anyone that's on Medicaid and Medicare, if you want to page 2, it's a billing structure, that they would not be charged any more than what's allowed under the federal programs. And it states that individuals who do have insurance will be pursued until the insurance or the patient pays. You'll note that we do have some different language concerning town residents. What that would provide is that once the insurance company payment is received from the town resident, that would be the end of the process.
Mr. Chair,
Mr. Bean.
Could I ask that we table this until the next meeting? Because just receiving it today, I think I'm gonna have a number of questions on this, and I'd like more time to look this over and you know. I mean, that's up to the rest of the board. I think I need some more time to digest what we're doing here and, you know, being asked to do.
I don't have any issue if you want additional time. What I can tell the board is, in our ALS meetings, the CEO of Pro Ambulance came in. One of the first questions he asked, pieces of information he wanted to know was, what are we billing out in terms of our ambulance rates? And right away, he said to us they were woefully low, especially where, as Mr. Delacorte had pointed out, Medicare has just reduced their rates. So currently, our rates for private insurance billing is tied into Medicare plus a certain amount. He said, you're actually suffering a loss of revenue because Medicare had reduced their rates. He had suggested the numbers that we're looking to impose here are actually probably in the middle range. His company actually charges more than what we're suggesting here, or what the administration is suggesting here, that we should raise our rates to. And what he had indicated to us is Medicare's gonna pay that amount, the Medicare amount, and that's it. You're not gonna get a dime more. You're charging $10,000, you're gonna get the Medicare rate, and that's all. And he said private health insurance carriers will pay up to these amounts without any question. So, if that gives any more insight into the discussions we had.
And I don't think he's bringing that up to say we ought to move forward. I think
No.
if we
Yeah.
want to wait another week, that's fine, it's not gonna hurt anything.
Right. I mean, I would like to see, I'm
But
gonna need some more clarification on how much more of this will the patient be responsible for? Because some of these rates are increasing 100%. And, you know, and again, I'm gonna need a little more time to digest this, because, I mean, I know we all complain, and rightfully so, about the cost of health insurance. Well, this certainly is not gonna help the cost of health insurance to go down if we're charging them 100% more.
Well,
No, it's
he
not
answered that
intended
question.
Yeah,
to.
He
you know what I'm
actually-
saying?
He actually addressed that, the CEO addressed that, and indicated that there was a push not too long ago by health insurance companies to address ambulance,
Yeah.
cost of ambulance billing. And once they got a pushback from a number of either municipalities or ambulance service providers, private providers, once they got a little pushback, they backed off from it because it's such a small amount of what they're paying in terms of health insurance, that it really didn't matter to their bottom line. They backed off. Once they got any opposition, or once there was a lobbyist action
Yeah.
against it, they backed off. And he said, health insurance companies are paying very similar rates across the board.
Yeah, I still would like to look into this a little more.
That's fine, I
board,
just wanted to give you a little more.
Yeah, because my big concern, like I say, is, and I don't have an example in front of me, but let's say the patient now would be paying $200. Some of these I can see where they would then be paying $825. And I gotta give that a lot of thought before I, can vote on it.